Before we start, let me acknowledge the online presence of Senator Amy Marcos and Senator Mig Subiri, our Majority Floor Leader. Today we have the following matters on our agenda. First, the bills mandating the deferment of the increase in PhilHealth premium contributions. Senate Bill 2000, which I filed, Senate Bill 1977 of Senator De Lima, and House Bill 8461, grant the President the authority to defer the scheduled premium increase. And Senate Bill 1971 of Senators Gordon, Senate Bill 1968 of Senators Po, Subiri, Villanueva, Angara, Binay, and Gatchalian, and Senate Bill 1966 of Senator Amy Marcos mandate the suspension of the scheduled premium increase. Second, in our agenda are the bills establishing public health and environmental standards and safeguards for the better normal in the workplace, public places, and communities. Bills were filed by Senators Tolentino, Angara, and Marcos. May we now request the committee secretary to acknowledge the resource persons who are with us today. Ms. Committee Secretary, kindly.
Yes. Good morning to everyone. Good morning to our chair and senators and all the attendees of this hearing. We would like to acknowledge the resource persons who are already here. For the bills on suspension of the scheduled increases in PhilHealth premium contribution rates, we have Attorney Dante Gueran, President and CEO of PhilHealth, together with Nerissa Santiago, Acting COO, Emily Roque, Acting SVP, and Mr. Oscar Abado, Vice President. Yusek Mario Villaverde of DOH. We have Rosalia V. De Leon, Treasurer, Bureau of Treasury of the Department of Finance. Attorney Samuel Dagpin, Chairman GOCC, Governance Commission for GOCC. From the DBM, we have Mary Grace Darunday, John Ree Castillo, Lorianne Javier, Queni Alisa Tamayo, Maria Sofia Tejerero. From UP Manila, we have Dr. Vicente Belisario, Dean UP College of Public Health, and Dr. Carlo Panelo, Professor UP College of Medicine. From the Philippine Hospital Association, Dr. Jaime Almora. From the Philippine Medical Association, Dr. Maria Roda Goco and Dr. Mercedes Agustin. For the bills on Better Normal, we have the following: Dr. Beverly Lorraine Ho, Director for Health Promotion Bureau, and Director for Disease Prevention Control Bureau of DOH. Girly Grace Casimiro Igtiben, OIC Director, Social Development Staff of NEDA. From DOTR, we have ASEC Amard Eje and ASEC Sheila Napalang and ASEC Nixon Fortes. For DTI, we have Remedios Lim, OIC Division Chief, Board of Investments. For DepEd, we have Abraham YC Abanil, Director 4. For DICT, we have Leo Cipriano Orbistondo Jr., OIC Director 4, Government Digital Transformation Bureau. From DOLE, we have Sylvia Valdez of Bureau of Working Conditions and Dr. Marco Antonio Valeros of Bureau of Working Conditions. From the DA, we have Attorney Abraham Giao. From the LGUs, we have Angelica Sanchez, Policy Director, League of Provinces of the Philippines. Janelle Rabe from the League of Cities of the Philippines. From ECOP, we have Robert Maronilla. And from UP Manila, Dr. Carlo Panelo and Dr. Vicente Belisario. From TESDA, Celestino Millar. And from CHED, Sheila Halbuena. That's all, Mr. Chair. Thank you.
Thank you, Ms. Committee Secretary. The Universal Healthcare Law, or UHC, was enacted in 2019 with the objective of ensuring that all Filipinos are guaranteed equitable access to quality and affordable healthcare. To achieve this, the law mandates a schedule of premium contribution rates which increases until 2025. This year, the premium rate is scheduled to increase to 3.5% of the monthly basic salary of the direct contributor from 3% in 2020. When the law was crafted, no one knew that a pandemic would hit us. Although the increase in PhilHealth contributions ensures sufficient funding for the healthcare of its members as mandated by the UHC law, it is only reasonable and equitable to postpone incremental premiums due to the bad economic conditions caused by the pandemic. Ano? Okay lang. Ma'am Amy, the government as a whole must do its best to unburden Filipinos by shouldering the cost while ensuring that the universal healthcare law is implemented and the services of PhilHealth are unhampered. Since the increase in PhilHealth contributions is mandated by an existing law, specifically the UHC law, we are currently studying possible legislative interventions to pursue the deferment of at this time. Nasa health emergency ang bansa, walang kakayahan ang mga Pilipinong magbigay ng dagdag na kontribusyon dahil sa krisis. Sabi nga nila, in this time of crisis, every single peso counts. Dahil po sa COVID-19, kinailangan nating magkaroon ng community quarantine. This led to a record unemployment rate of 17% in April 2020. Aside from that, several micro, small, medium enterprises were forced to close down. Nagsabi na po si Pangulong Duterte, sang-ayon po siya na ipagpaliban pansamantala muna ang pagtaas sa premium rates ng PhilHealth habang may pandemya pa tayong kinakaharap. Gawin natin ang lahat ng ating makakaya para mapagaan ang pinapasan ng taong bayan. Hirap na po ang ating mga kababayan, huwag na natin silang mas pahirapan pa. Karamihan nga sa kanila na wala ng trabaho, including OFWs po. Paano magbibigay ng remittances po yun at increases in contributions and nawalan po sila ng trabaho. Tulungan na lang po natin sila. Paano natin pagbabayarin ang ordinaryong Pilipino na nawalan na nga ng kabuhayan? Tulad ng sinabi ng Pangulo, it is the job of the government to make it easy for everybody at this time. In response to the PhilHealth's call to suspend premium increase, PhilHealth already announced it would continue to use the 3% contributions rate as opposed to the 3.5%, but noted that should be no no new legislation passed for this purpose. It will proceed with a scheduled premium rate and ceiling as provided for in the UHC law. Let us work together to find a viable solution to achieve universal health care for all without imposing unnecessary burden to ordinary Filipinos during this challenging time. Dumating na po ang unang batch ng mga bakuna noong linggo at nagsimula na po ang pagbabakuna sa ating mga health workers. The delivery of Sinovac vaccines is the start of the country's vaccination program. Matatapos rin po ang pandemyang ito at sabay-sabay tayong babangon mula sa krisis na ito na nagtutulungan sa ating kapwa Pilipino at nagkakaisang mamamayang Pilipino. May I ask my fellow senators if they have any opening remarks regarding PhilHealth premium deferment? Senator Amy, do you have any opening statement or?
Yes, thank you very much. Thank you very much to my good chairman, Senator Bongo. And certainly we are fully behind the president in his effort to
How
make
about
life.
our majority floor leader, Senator Subiri?
Yes, thank you very much. And once again,
Anyway, before we move forward, let me reiterate to our resource persons, please put your microphones on mute so we can have an orderly discussion. And if you wish to be recognized, please click the raise hand button on WebEx and wait to be recognized. For my fellow senators, anytime you have questions and manifestations, just feel free to interject.
yes, thank you very much.
To start off, let us hear the presentation of PhilHealth. Kindly discuss to us the effect of the deferment of the premium increase. PhilHealth representative, kindly.
If I may, Chairman Go, I was speaking, if it's okay. That's Amy. It's just Amy. I am one of the authors. Hello, can I be heard? Sorry. Hello? Oo, si Amy po.
Ma'am Amy,
Yes.
are you raising your hand po? Dito sa hearing, sa health?
Yes, that's correct. I was speaking.
Hindi namin kayo naririnig.
Naririnig mo na ako? Hi. Can you hear me?
Sa atin ba?
Oo,
Senator Amy, we cannot hear you po.
okay. So sorry. Okay. Nasa unmute ako eh. Okay. Okay, thanks. Sige. Nasa admin eh. Okay, sige.
Yeah.
Pakitawag si Rose. Si Rose lang.
We have technical difficulty. Hearing suspended for a few minutes.
Bakit wala? Wala siyang, hindi ko marinig. Hindi kami magkarinigan.
now recognize. Go ahead, Ma'am Amy.
Yes, thank you very much. Yes, to my good chairman. I just wanted to extend my wholehearted support to the president in his effort to fight the pandemic in every way and make our citizens' lives comfortable and sustainable. So, yung bill ko, simple lang, yung Universal Healthcare Act to be suspended para sa isang taon lamang, 2021. Fearing that this would deplete the coffers of PhilHealth, which, as we know, may be already at risk at this juncture. Perhaps we can come to an agreement on Senator Gordon's effort to grant the president the power to suspend such scheduled increases. So para magkaisa na tayo dyan, pero during periods of emergency. Parang ganun yung compromise. The President of the Philippines shall have the power to suspend schedule increases during the period of emergency or calamity. Para sakto at ibigay na natin kay Pangulo. Yun lang ang aking masasabi, ngunit wholehearted support po sa administrasyon at yung effort kontra COVID. Salamat.
Thank you, Senator Amy. Let us now hear the presentation of PhilHealth. Kindly discuss the effect of the deferment of the premium increase, kindly. Let me recognize also Senator Mig Subiri, our ever hardworking majority floor leader from Bukidnon. Sir, do you have any opening statement or message?
Salamat, Chairman. Yeah, before siguro sa PhilHealth para hindi na sila madisturbo pag-present. Of course, my deepest gratitude for the Chairman for hearing this measure, as well as to my colleague, Senator Amy, who are listening in now. Of course, our head of PhilHealth, my dear friend, Chairman Geran, sir, and to all our Mayong Buntag, and to, of course, to all our resource persons and other colleagues. Pleasant good morning. I'm here to support Senate Bill number 1968. Senator, our Chairman Bong, this one is, I'm also co-author of this measure, which is deferring, of course, the contributions done during the pandemic. We all know the difficulties, as mentioned earlier by Senator Amy, we all know the difficulties that the people are facing now in this time of pandemic, and an additional increase of their contributions of laborers particularly, medyo masyado na mabigat. Imagine kung sinabayan natin yung SSS plus PhilHealth, a big chunk of their take-home pay would have been eaten up by these contributions. So maraming salamat, Chairman. Hiniring nyo to kaagad, and hopefully may pasa natin to sa plenaryo, and I will support you bilang isang principal author nitong 1968, Senate Bill 1968, and all the other measures of similar nature. We'll make sure i-prioritize natin to chairman sa floor. Hindi na kayo mahirapan pa, at maipasa natin kaagad sa lalong madaling panahon to allow our people a bit of respite from all the expenses, especially during this time of pandemic. So maraming salamat, Chairman, and we'll just listen intently to the explanations of our different resource speakers and resource persons. So maraming salamat, Chairman. Daghan kayong salamat.
Thank you, Majority Floor Leader Senator Subiri. Before we start with the PhilHealth, I have one question with our CEO, President of PhilHealth. Ano na pong update doon sa yung sa ina-account ninyo na unaccounted po na funds ng PhilHealth na sinabi nyo po na about 90 to 92% na po ang accounted. Pwede bang abutin mo ng 100% yan at wala pong dapat na masayang na pera po ng gobyerno, dahil talagang every single peso counts dito. pinagpawisan po yan ng ating mga kababayan, yung perang yan. In fact, yung mga OFWs natin, mahirapan nga po silang magbayad ngayon dahil marami pong nawalan ng trabaho. So masakit po isipin na may mawalang ni piso po na pera po ng taong bayan dahil alam naman natin na pinaghirapan po yan ng ating mga kababayan. I trust PhilHealth. I trust most of you. Alam ko pong karamihan po sa inyo ay gusto pong manilbihan at magserbisyo po sa ating mga kababayan ng buong katapatan. Meron lang po namang iilan lang po dyan na talagang walang konsensya. So I know na you're doing your job, kaya ka po nilagay ni Pangulong Duterte dyan because you have his full trust and confidence na may babalik po sa tuwid at sa tama ang pamamalakad dyan po sa PhilHealth po. President Geran, you may answer first my question.
Good morning, Honorable Chairman of the Health Committee of the Senate, Christopher Lawrence Bungo, sir. As a matter of fact, ikaw ngayon nag-recommenda sa akin kay Presidente. And then, of course, ang ating senador po sa Mindanao, Senator Mix Sobere, Sir Idol. And of course, yung paborito namin at saka laging doon susuporta sa amin, si Madam Senator Amy Marcos, na yung nabigat sa iyo, ma'am. Doon po sa tanong po ni Senator Bungo kung ano nangyari doon sa IRM po. Ang IRM po ngayon is 95% na po liquidated. The original amount that was disbursed to 711 facilities, meaning hospitals, was 14.9 billions. And as of the latest, ang na-liquidate na po ay 14.2 billions. So ibig sabihin, that is already 95% liquidated. We would like to assure the good chairman that we will liquidate this fully in due time, hopefully before the end of March of this year. Thank you po.
Thank you, President Geran. So may we now hear the representative from PhilHealth about the effect of the deferment of the premium increases.
Before I will call on our Senior Vice President Nerissa Santiago for the financial facts of the PhilHealth on the effect of the deferment of the 3.5% premiums. Allow me first to read the position paper of PhilHealth. This corporation fully supports the proposed legislation on the deferment of the premium contribution adjustments for the direct contributors for CY 2021 as provided in Section 10 on premium contributions of the Public Act number 11223, otherwise known as the Universal Healthcare Act. Bill numbers 2000, 1977, 1971, and House Bill number 8461 recommend the granting to the President of the Philippines the power to suspend or defer the scheduled premium contribution increases in times of national emergencies or when public interest so requires as prescribed in Section 10, RA number 11223. Senate Bill numbers 2000 and 1977 propose that the PhilHealth Board recommends or be consulted upon by the President of the Philippines on the suspension of the scheduled premium increase. Senate Bill number 1971 provide that the suspension or deferment of the increase in the premium contributions as mandated in times of a declared national emergency or state of calamity within the period of no more than 6 months may be extended to another 6 months as may be appropriate and necessary in the interest of the public. House Bill number 861 provide that the President of the Philippines shall consult with the Secretary of Finance and the Secretary of Health as chairpersons of PhilHealth. Senate number or numbers 1975, 1968, 1960 recommend the suspension of the increase in premium contribution for 2021 or upon declaration of a state of national emergency or state of calamity. Senate Bill number 1975 further provides that any adjustment in the premium rate following the suspension shall not be higher than 0.5% from the immediate preceding premium rate. The Senate bills provide for the resumption of the mandated increase or premium contribution as prescribed in Section 10 RA 11223 following the cessation of the national emergency or public health emergency. The Public Act number 11223 or the Universal Health Care Act was one of the legislative legacies of this Honorable Congress and of the administration of our dear President Rodrigo Rua Duterte. The law ensures that our healthcare system will be more accessible and responsive. All Filipinos are now automatically enrolled and entitled to the benefits of the National Health Insurance Program in its IP. However, we did not foresee the COVID-19 pandemic would be coming into our lives. It has greatly affected the lives of our countrymen going through with the new normal. That is paraphrasing earlier statement of Chairman Bungo. It has also challenged the readiness of our health care system. The economy has entered into recession due to the community quarantine and public health protocols that need to be enforced and observed. This corporation recognizes that the source of livelihood of 7.3 million Filipinos have been affected. Unemployment rate reached a historic high of 17.7% in April of 2020, last year. Moreover, there have been closures of businesses, particularly the medium, small, and micro enterprises. Report from the Department of Trade and Industry, DTI, that 26% of surveyed businesses will close during the lockdowns. The corporation has already expected the difficulty of self-earning Filipinos and professional practitioners, even the migrant workers and private businesses, the employers to recover and rebuild their economic activity towards the pre-pandemic level. There have been proposals within the corporation and public clamor to defer the adjustment on the increase of premium contributions for calendar year 2021. The corporation supports the various legislative proposals on the granting the President of the Philippines the power to defer or suspend the schedule of increases in premium contributions in times of national emergencies when public interest so requires, provided that the subsequent scheduled increases in the premium contributions shall be adjusted to the years following the lifting lifting of the suspension. This is in order to support its IP, including the increase in PhilHealth benefits to be provided to all Filipinos. For the consideration of the Honorable Committee. Thank you, and I request Ms. Nerissa Santiago to make the presentation. Thank you po. Good morning again.
Salamat, President Giran. May we hear the position? Meron pa, Present. Go ahead with your presentation, please.
This is Nerissa Santiago of PhilHealth. Representing the, can you hear me clearly po? Can you hear me clearly po? Hello?
Go ahead, Ma'am Nerissa Santiago. Go ahead.
Thank
Go ahead
you.
with your presentation.
Okay, I'll just make sure that they hear me. Okay, I will be presenting the PHIC projections on the premium deferment. Next slide. Just to refresh your on the UHC Act aspirations on the UHCQ, wherein this is our mandate for PhilHealth. So the three dimensions of the UHCQ includes the coverage of around 100% of the population, and the benefit coverage would be the second dimension, wherein all the benefits are all medical illnesses will be covered. And for the third dimension, we want to cover as much as possible the medical expenses of the patient. So the support value is very important for PhilHealth to be able to increase the support value and lower the out-of-pocket cost for the patients. Next slide. To operationalize this, PhilHealth for the coverage of the 100% population, the immediate eligibility provision as stated in the law is being implemented right now by PhilHealth. So anybody who goes into the hospital and gets confined will be covered by PhilHealth regardless if they have paid their premiums. So the immediate eligibility is already enforced right now. For the expansion of the benefit coverage, access to a doctor whenever needed. This can be addressed by implementing the primary care benefit, which is right now we are calling consulta. And as stated in the law, we need to put in within the 2 years of implementation of the UHC Act, a comprehensive outpatient benefit. On the third dimension, which wherein we need to increase the support value of PhilHealth, we want to reduce the out-of-pocket by increasing the support value, implementation of the fixed co-payment, as well as complementation with the HMO coverage. So these are the operationalization plans of PhilHealth to achieve the UHC Act aspirations. Next slide. Keeping these aspirations in mind, we want to look into the projected impact of the premium deferment of the premium hike as stated in the law, especially for the direct contributors. For 2021, the total impact of the COVID or the pandemic as well as the premium hike deferment would be about 20.2 billion. This is due to the decrease in the number of payers as well as the premium deferment. So basically, before the COVID, we were expecting a collection from the direct contributors of about 103 billion. Because of the decrease in the number of payers, This decreased to about 96 billion. And if we will be deferring the premium increase for 1 year, this will further decrease to 83 billion, with a total decrease due to the number of payers and premium deferment of 20.2 billion. If we expect the pandemic to still be, it will still impact the 2022 numbers. This will, and of course, the premium deferment will be in effect instead of 2020 effectivity of the increase in premium, it will be in 2022. The decrease will be greater at 44.4 billion, coming from 136 billion before the COVID, and then because of the lower number of payers, this is projected to decrease to 105.6 billion. And because of the 1 year premium deferment, this will lower further by to 91.7 billion, with a total of 44.4 billion in decrease in the collections, projected collections. Next slide. As a result of this premium deferment, we expect to collect in 2021 about 154.6 billion. This includes the subsidy of the government for the indirect of 71.4 billion, plus the collections from the direct contributors, and giving a benefit of a consulta for a pilot site of about covering about 25% of the population. The benefit expenses is expected to be at around 172 billion. This will still include COVID inpatient as well as COVID tests that are being covered currently by PhilHealth. And net income or loss, net loss for 2021 would be about 17 billion as a result of the lower collections and higher benefit expense. This will lower the reserve fund to about 143.5 billion, coming from 160.6 billion from 2020. Take note that these are tentative figures for 2020, since we are now finalizing the December 2020 financial statement. For 2022, we expect the income to be 176.9 billion, both from the direct and indirect contributors, with an investment income of 5.5 billion and the expenses at 230.4 billion. The 230.4 billion includes further expansion of the consulta to a bigger chunk of the population, to about 75%, 50 to 75% of the population by 2020. So this will result to a net loss of about 60 billion from higher benefit expense compared to the collection in 2020. This will, because of the deficit or the net loss, this will further decrease the reserve fund to about 83.7 billion. I think this is my last slide. Thank you, Your Honors.
Salamat, Ma'am Nerissa. Question to Ma'am Nerissa or to President Kiran. Hanggang kailan po yung capacity ng PhilHealth to shoulder expenses na ng magkaka side effects po sa COVID-19 vaccine? Magkano naman po ang coverage na to kung sakasakaling magkakaroon ng side effect po due to COVID-19 vaccine?
Sir, Senator Bongo, we have the impression, of course, that the government will fund something like 500 millions ay intended for the adverse effect of COVID inoculation. So that amount will be additionally provided by the government through the Congress, the Senate, and it will be a buffer to answer for any adverse effect that wag naman that the inoculation would bring.
Thank you, President Kiran. Another question, no? Kumusta po yung inyong collection at expenses for 2020? May income ba kayo nung nakaraang taon? Kailan ho ba kayo assume as a president? I think last quarter of 2020 ho ba yun?
Senator, I assumed presidency and chief executive officer of this corporation last September 17, 2020. With respect to the question about the income, no? As earlier presented, they how much collection?
157. Mr. Chair, there is a bullet. For 2020, our expected collection is about 157.9 billion. This is about 9% increase from the 2019 collection. So, but because of this is due to the increase in the premium rate that we have effected in 2020 as stated in the PHC Act. This is a 0.5% increase for 2019. So supposedly we were expecting about 17 to 20% increase in collection because of the premium rate hike. But because of the pandemic, we only realized about 9% increase. Your Honor, Mr. Chair.
And magkano po ang nagastos ng PhilHealth sa testing at payment ng COVID-19 hospitalization noong 2020? Are we expecting na tataas pa po ito ngayong taong ito or not, no? Dahil meron na tayong bakuna, nag-uumpisa na po ang ating pagbabakuna.
Mr. Chair, although we have limited payment for the COVID inflation and COVID testing because of the delay in the payment, in the submission, because we have affected the 120 days extension for the hospital to submit their claims. Our expected payment for 2020 is about 15 billion for the inpatient and about 9 billion for the COVID tests. For 2021, we still expect to pay COVID inpatient, although at a lower amount, and also COVID tests for 2021. But because of the COVID vaccination, we expect this to be lower amount for COVID inpatient and COVID tests, Mr. Chair.
Salamat po, ma'am. Have PAGCOR and PCSO remitted their contributions to PhilHealth, which shall be used by PhilHealth to improve its benefit packages?
Mr. Chair, the provision of the law, particularly the PhilHealth, the Universal Healthcare Law, provides for this managed corporation of the government, PAGCOR and PAGCOR and PCSO to remit to PhilHealth as a support for the healthcare program of the government. But you know, Mr. Chair, the remittance is not directly through to the PhilHealth. The remittance was made through the Bureau of Treasury. So sa totoo lang po, parang walang nangyari na na remittance. Talagang walang nangyari because direkta sa sa Bureau of Treasury. Binibigyan kami ng we are given the budget for the year as a regular budget based on our needs, but actually the support that was supposed to be coming from these two managed corporation to government is parang wala kaming naramdaman kasi andun diretso na po sa Bureau of Treasury.
Salamat, President Kiran. How much is expected drop in the number of payers this year? Do we expect to improve in 2022 since we now have COVID-19 vaccines? Baka makabawi naman po tayo sa 2022 ang kakulangan natin for 2021. What is your projection?
The projection that we had is a 5 million what we call decrease in the number of payers, direct contributors. But positively speaking, especially that we are already exposed on how to combat COVID, the incidence of COVID in our new normal life, we believe that this will increase in due time, even before this year ends. We have just, Mr. Chair, we have just to be positive. We have to help each other. Bawasan natin pamulitika. No? We'll help the president, we'll help government, we'll help the PhilHealth, and will benefit everybody. And kailangan po ang help because ito na po how can we say that a government is productive, a government is very successful if the health of our people is what we call this not so good. So kailangan talaga, Mr. Chair, na health ang importante ng tao.
Salamat, President Kiran. May we hear the position of the Department of Health, where we recognize Yusek Mario Villaverde for his statement.
Magandang umaga po, Mr. Chairperson, Senator Bongo, and the two other senators who are present, Senator Mick and Senator Amy Marcos. The Department of Health acknowledges the intention of the proposed measures that seek to defer the PhilHealth premium increase when public interest so requires, such as times of national emergencies like we are now. And Section 10 of Republic Act number 11223 or the Universal Healthcare Act provides for the schedule of the PhilHealth premium rate from 2019 to 2025. For 2021, the premium contribution relative to monthly income will increase to 3.5% from 3% in 2020. But given the current challenges caused by COVID pandemic to the livelihood and economic status of Filipinos, deferring the said section's implementation is deemed justified and necessary. Further, the measures granting the President of the Philippines the power to suspend the scheduled increase in PhilHealth premium considers the urgency of the situation and provides some flexibility in terms of premium payment in case national emergencies will occur in the future. So based on the foregoing, the DOH strongly recommends to only defer the PhilHealth premium increase when public interest so requires, such as times of national emergency. The deferment of the scheduled increase in premium contribution will result in the same benefit packages currently being offered by PhilHealth because the law states there is no reduction of what is currently being provided as benefit. However, if there will be an increase in employment as we are noting now, it is expected to result in an increase in the indirect contributors to PhilHealth, and the increase in indirect contributors to some extent will have a toll on PhilHealth fund life. This will warrant a recommendation to ensure alternative or additional sources of funding, preferably by the national government, to minimize the additional cost impact. A supplemental funding to cover the increase in the indirect contributors will ensure the implementation of Universal Healthcare Act, with PhilHealth being mandated now to fund individual-based health services, with the DOA funding or providing support to the population-based health services. So this is aligned with Section 10 of the Universal Healthcare Act, as that the DOA, in coordination with PhilHealth, may request Congress to appropriate supplemental funding to meet targeted milestones of the Universal Healthcare Act. So, Mr. Chair, that is the position of the Department of Health. We fully support the implementation, the deferment of the implementation of the increase in premium, provided that there is some safety net for PhilHealth to absorb the increasing number of indirect contributors through some form of supplemental funding to cover their premium contribution. So that's all, Mr. Chair.
Salamat, Yusek. May we now call on Treasurer Rosalia De Leon, Department of Finance representative to the PhilHealth Board, to give us the position of the DOF and an assessment on the proposed deferment. May we call on Rosalia De Leon po?
Ano ba to? Teka, ma'am. Ako daw? Nina? Ako ba? Yes, ma'am. Kaya po. Good morning, Senator.
Go ahead po, ma'am. Good morning.
Okay. Good morning. We're trying po para maayos mo kayo sa video. Good morning, Senator Bongo. So, while we note that the COVID-19 pandemic has severely disrupted the livelihoods of our people, we are submitting our observations on the proposed deferment of the increase in premium rate of PhilHealth as follows. First, assuming that the premium rate will be increased to 3.5% in 2021, the additional contribution of each direct contributor will only range from 50 pesos to 650 pesos, depending on their monthly income. This increase will be shared by both the employer and the employee. Second, the impact of the deferment of the increase is significant, as it will reduce the collection of PhilHealth by 17.7% or 15.6 billion pesos when compared to the original projection in 2021. Aside from the impact of the proposed deferment, the drop in the number of payers due to COVID-19 should also be considered. It is expected that there will be a decline in the number of payers of about 5 million from 18 million payers in the 2021 original projection to 13 million payers in the revised 2021 projection. Accounting for this, we expect a shortfall in the collection amounting to 20.25 billion when compared again to the 2021 original projection. Anticipating this, the Board of Directors of PhilHealth already reduced its 2021 program expenditures for its primary care benefit package or the Konsultasyon Sulit at Tama by 17 billion. Likewise, with the deferment in the premium rate increase and the reduction in the number of payers, PhilHealth is expected to book a net loss of 17.5 billion this year. This is expected to be covered by the institution's reserve fund, which will reduce the said fund from 160.6 billion to 143.5 billion. The implication is that it will shorten the fund life of PhilHealth by 6 months from August 2028 to February 2028. And of course, as we already know, as of December 31, 2020, the total liabilities of PhilHealth, including the contingent liabilities, already amounted to 6.09 trillion. We hope that these observations that we have shared with the Senate would be useful during this Senate's deliberations. Maraming salamat po.
Salamat po, Ma'am Treasurer Lea. Gusto ko lang pong linawin, yung PhilHealth Reserve Fund is projected to be exhausted in 2028. Ibig po sabihin ba nito na hanggang 2028 po, meron tayong pondo sa PhilHealth at wala po tayong dapat alalahanin sa ngayon kahit na i-defer po natin ang increase ng premium?
Ano po, Your Honor, Senator Go, yung pong PhilHealth na fund life, bababa nga lang po from August 2028 to February 28. So tama po kayo, meron pa pong pondo, kaya lang nga po, bumaba po, nag-exceed po by 6 months. Yung pong fund life from August 2028 to February 2028.
Salamat, ma'am. May we now recognize the GOCC, ito pong Governance Commission for GOCCs. Chairman Samuel Dagpin, Secretary Samuel Dagpin, may we hear your position?
Okay, good morning, Senator Lawrence Tigo and Senator Amy Marcos and Senator Mix Tubiri. On the part of GCG, we fully support the pending bill deferring the increase for 20 of the premium contribution. I understand that PhilHealth presented a while ago their projection of the impending deficit for the consideration of the committee. They submitted to us the briefer on the impact of the premium increase deferment. First is the number of payers compared to the number of beneficiaries. So it depends on numbers. Second is difficulty in capturing the informal market, individually paying members and OFW. So I suggest that the national ID system be fully implemented to this one. Third is the decrease in the number of payers as a result of economic downturn due to the pandemic. This is the real situation as of this time. And number 4, they are banking or the retention of the premium rate of 2020 and for the coming year effective 2021. So the last year increase will still be implemented. Fifth is there has been no transfer of funds from PAGCOR and PCSO. Based on the assessment of the GCG, this is a direct provision that this must be undertaken. I hope that a mechanism will be done for the immediate transfer of the PAGCOR and PCSO contribution to PhilHealth. And 6 is the government subsidy for the indirect contribution had not increased since 2019, even with implementation of USC. So it's the same from the 2019 GAA and the 2020 GAA for the subsidy for PhilHealth. I hope all these matters will be addressed for the to so that the impact of the deficit with respect to PhilHealth and which directly affect the PAN-LIFE, which the Bureau of Treasury mentioned that it will be until 2028. But be that as it may, we fully support this measure of the Honorable Senator Lawrence Tigo for the deferment of the premium increase for 2021, giving authority to the President to do the action. Thank you, sir.
Salamat, Chairman Dagpin. May we now recognize the DBM. Please share us your position and give us an update if we can increase the subsidy to PhilHealth next year, given that they will be on a loss this year. DBM John Ree Castillo, Chief Budget and Management Specialist. Go ahead, Sir John Ree.
Good morning, Mr. Chair, Senator Bongo, and other honorable senators and fellow public servants. The position of the DBM with respect to the Senate bills in consideration is as follows. We interpose no objection with on the matter of the said amendments to defer the implementation of the increase of the premium contribution of the direct contributors, in as much as this proposal or proposed amendment will not entail additional premium subsidy support from the national government to the PhilHealth. While we recognize the estimated loss by the corporation, we would also request for revisiting the assumptions and considerations for us to properly justify the subsequent increase with respect to the indirect contributors. While we recognize that the same has been same rate or premium rate since 2019, the same is due to the limited available funds, mainly because of the national government revenues and the possible implication of the Mandalas Garcia ruling with respect to the total collection. Hence, we would require the revisiting of the assumptions and the estimates of the collections versus the projected benefit expense, because we understood that the projected benefit expenses include some of the accrued expenses and not of the actual benefit expenses paid by the corporation year on year. And also, we would consider the developments in this meeting with the deliberation of the forward estimates being conducted now by the national government, the 3-year forward estimates for the corporation and other government corporations. And possibly we would like to seek the support from the honorable representatives and senators to push forward to find for other ways for us to improve the financial condition of the corporation. And with that, we reiterate that we interpose no objection on the said amendment, particularly on the deferment of the premium increase for the direct contributors. That's all, Mr. Chair. Thank you po.
Salamat po, Sir John Ree. May we now hear the insights of our health experts, led by Dr. Vicente Belisario of the University of UP, National Institutes for Health. Dr. Vicente Belisario, kindly. If wala pa po, si ano na lang po, Dr. Carlo Panelo of the UP College of Medicine.
Good morning, Honorable Senator,
Sir,
Mr. Chair.
kamag-anak kayo ni Attorney Sal Panelo?
We couldn't trace our direct connections, Mr. Senator, but I know the wife of the good secretary. But I am from Davao, sir. Mayong buntag.
Bisaya po day.
Bisaya. Sir.
Go ahead, Dr. Carlo Panelo. May we hear your insights on this proposed deferment.
Thank you, Mr. Chair, for this invitation to provide inputs. I would like to inform the committee that my views do not represent the position of UP Manila nor that of my other institutional affiliations, and my inputs are totally my responsibility. I wish to commend both houses of Congress for taking the initiative to legislate this measure that allows the country to ease pressures on the government, private employers, and individual contributors as far as PhilHealth payments is concerned. It is understood that this legislation is intended to specifically formalize or legalize an earlier decision and action taken by the executive branch to suspend the implementation of mandated premium increases in 2021. This bill for this particular purpose should be passed immediately. As the bills are largely similar, when I reviewed them, this can be readily consolidated into a single version. The passage of the bill should, however, recognize the risk that PhilHealth could dip into its reserves and will require additional subsidies when needed. PhilHealth can be made to report to Congress on its collection performance, amount of benefit payments, and benefit delivery performance as basis for requesting additional premium subsidies. The additional subsidies will also need to take into account the expected premium collection deficit as presented earlier, but also a possible decline in benefit payments due to lower utilization of services during the pandemic. Initial studies show that utilization of specific services went down by around half, owing to quarantine restrictions in movement, as well as the fear of individuals to actually get exposed. While I'm recommending the passage of the bill, it is also recommended that Congress take this opportunity to review the premium policy for the National Health Insurance Program. Over the long term, it is recommended that premiums should be paid commensurate to benefits and not as a form of cross-subsidy. In principle, premiums are not the best instruments for income redistribution, as this is best addressed through taxation. It is therefore recommended that government come up with a financing policy that premiums are set according to benefits and premium subsidies to cover the shortfall be taken from taxation. Our current system is born out of our historical and ongoing experience where the NHIP relies heavily on the formal sector to subsidize the poor, the seniors, people with disabilities, and most especially the informal or individually paying members. In the long run, the mandatory increases in premium will prove to be a heavy burden to direct contributors or formal sector employees such as myself. It is also recommended that premium rates not be legislated and be left to the executive branch to set, as this will require periodic review. The executive should also be empowered to suspend and adjust premiums subject to the approval of the board. On its part, Congress can lay down the basic principles and expectations in terms of NHIP performance as basis for the release of subsidies on an annual basis. Maraming salamat po. Magandang umaga sa lahat.
Thank you, Dr. Panelo, on your personal insights. May we now hear Dr. Vicente Belisario of the University of Philippines National Institute for Health. Go ahead, Doctor. Wala pa rin po. May we hear also from other stakeholders, Dr. Jaime Almora of the Philippine Hospital Association.
Good morning, Honorable Chair. Thank you for recognizing the Philippine Hospital Association. The Philippine Hospital Association supports the proposed bills deferring the increase in the premium contribution of the health workers. We hope, however, that there will be no decrease in the premium benefits and that any increase in premium benefits that is needed should still be implemented. That's all, Honorable Chair. Thank you.
Salamat po, Dr. Jaime Almora of the Philippine Hospital Association. Anyway, thank you to our resource persons. We have two approaches. Ano? With that, the committee will study all your inputs and will come up with a committee report for approval. The bottom line is we are all in agreement that the premium increase should be deferred for this year given the crisis we are facing. May we now proceed or move to our next topic? We shall now discuss establishing public health and environmental standards and safeguards for the better normal in the workplace, public places, and communities. May we ask the position of our agencies? Is there a need to institutionalize these COVID-19 measures that we are taking? May we now hear your position? Number one on our list is Dr. Beverly Ho of the Department of Health.
Thank you very much, Senator. On behalf of the Department of Health, allow me to read our position paper. Thank you very much. The DOH supports Senate Bill number 1642, 1747, 1792, and House Bill number 6864. Which aim to provide the creation of protocols and standards that take into account the better normal paradigm brought about by the COVID-19 pandemic. We also appreciate the alignment of the provisions with the minimum public health standards that have already been set by DOH-AO 2020-0015, or the guidelines on the risk-based public health standards for COVID-19 mitigation. Based on the foregoing, the Department of Health interposes no objections to the passage of the proposed bills, provided that all provisions are aligned with the latest policies and guidelines of the DOH and Interagency Task Force as it pertains to health standards. In view of this, we also propose the following recommendations in response to the final design of the bill. First, on universal and mandatory safety measures, include clear pronouncements on use of washable cloth face masks for the general public, while surgical or medical grade face masks are to be used by symptomatic individuals, healthcare workers, and other frontliners working in the healthcare facilities or involved in COVID-19 response. This is also in line with still relative global shortage of mask supplies. Next is to ensure that disease surveillance and contact tracing are aligned with the data privacy and ethical standards, which are already in existing legislation, IRRs, and DOH guidelines. Include a provision on the safety precautions for vulnerable populations and ensure access to mental health services. On the management of space, we support the call for use of more open spaces, recognizing that ventilation is clearly going to be a major determinant of infection transmission, and disinfection of government and privately managed spaces shall be routinely conducted. On management of public transportation, we support using payment systems that are electronic, And for those that involve cash transactions, allow mechanisms such as money trace and facilitate the transition to contactless cash transactions. On workplace-specific protocols and measures, we support the establishment that all establishments designate a health and safety officer to ensure compliance with the minimum public health standards. All establishments that will be resuming operations shall have internal protocols and mechanisms and include appropriate waste management protocols also, since many of them will be using PPEs. And finally, on the establishment of e-government systems, institutionalize and regulate telemedicine and e-prescriptions, which is aligned to the proposed e-health bill of the Department of Health. We respectfully submit our position. Thank you very much, Chair.
Maraming salamat, Dr. Beverly Ho. President Kiran is asking to be recognized for a short statement. Go ahead, President Kiran of PhilHealth.
Thank you again, Sir Bongo, for recognizing me. I'd like to spread into the records of this hearing today that under Section 37 of the Universal Health Care Act, particularly on appropriations, it says that in Section Paragraph B, it says that 50% of the national government's share from the income of the Philippine Amusement Gaming Corporation PAGCOR, as provided for in Presidential Decree number 18669, as amended, provided that the funds raised for this purpose shall be transferred to PhilHealth at the end of each quarter, subject to the usual budgeting, accounting, and auditing rules and regulations. Provided further that the funds shall be used by PhilHealth to improve its benefit packages. And paragraph C furthers that 40% of the charity fund net of documentary stamp tax payments and mandatory contributions to the Philippine Charity Sweepstakes Office, PCSO, as provided for the Republic Act number 1169 as amended, provided that the funds raised for this purpose shall be transferred to PhilHealth at the end of each quarter, subject to the usual budgeting, accounting, and auditing rules and regulations. Provided further that the funds shall be used by the PhilHealth to improve its benefit packages. So, ibig sabihin, Sir Chairman Bongo, direkta, sinabi dito, direkta ibibigay sa PhilHealth. Hindi nadadaan dapat sa BTR kasi may purpose po. At saka gusto ko rin sabihin na, sir, I have, at the PhilHealth, I have yet to encounter a kind of a corporation like PhilHealth, where ours is basically insurance, an insurance corporation. Ibig sabihin ng insurance, bago ang benepisyo, babayaran mo na ang premium dito sa PhilHealth. Kahit hindi nagbabayad ng premium ang Pilipino, automatic member ng Pilipino. Even yung sinasabi natin na site membership at your bedside, you can be a member. And there is immediate eligibility to appropriate medical services. Dito lang po, Mr. Chair, sa PhilHealth. Kaya dapat po, suportahan po natin ang PhilHealth. Maraming salamat po, sir.
Salamat, President Giran. Suportado namin kayo at ang buong PhilHealth. Basta bantayan mo lang yung bawat piso ng pera po ng PhilHealth ay walang masasayang. Yun lang pong pakiusap natin. Tulungan po natin ang ating mga kababayan. May we now hear the position of NEDA, Director Girly Grace Casimiro.
Good morning, Mr. Chairperson, Senator Bongo, Senator proposed bill on providing strategies and measures to minimize risk and ensure public health, safety, and security while easing the revitalization of economic and social activities in line with the thrust of the updated Philippine Development Plan 2017 to 2022 of having a healthy and resilient Philippines. However, there is a need to make some of the provisions more general to give flexibility to the bill, given that future pandemics may impact the country differently, thereby needing a different approach in attaining a better normal. Mr. Chair, the NED is currently finalizing its specific position and comments, and we will submit to the committee as soon as it is cleared by the Secretary. Thank you very much.
Maraming salamat, Ma'am Director Girly Grace Casimiro. May we now hear the position of DILG, USEC RJ Cheberry. Go ahead, sir. USEC RJ Cheberry. Next is may we now proceed to DOTR first. LTFRB Chairman Martin Delgra, another lawyer from Davao City. Go ahead, Chairman Martin Delgra.
Thank you very much, Mr. Chair, Senator Christopher Lawrence Bongo, the members of this honorable committee, fellow public servants here present. Thank you very much for the opportunity of the DOTR expressing not only our no objection, but also fully supporting the bills that were mentioned earlier, specifically Senate Bill 1747 and Senate authored by Senator Angara, and Senate Bill 1792 authored by Senator Tolentino, as well as Senate Bill 760 1762, if I may, as well as House Bill 6842 that has been endorsed by the House and approved by the House of Representatives. Allow us to, at this outset, express our support for a better normal for sustainable recovery, particularly in the provisions pertaining to the management of public transport, such as the continued use of face masks, maintaining social distancing, and social contact payment mechanism, all geared towards preventing the spread of COVID-19 virus. In line with this, we have, in fact, the DOTR as initiated and approved by Secretary Arthur Tugade in having to implement programs by which we'll be able not only to address public transport needs, but also addressing public health protocols in order to prevent the spread of the virus, which includes the DOTR's 7 rule, which are, if I may note, is already incorporated in the proposed bill, among which yung pagsusuot ng face mask at face shield, bawal magsasalita kung pwede, at hindi makipag-usap sa loob ng pampublikong sasakyan, bawal kumain, including yung frequent disinfection ng public transport facilities, not only in the vehicles that we use, but also in the facilities where public transport are put in place, as well as yung paggagamit ng temperature check, so that we'll be able to prevent symptomatic passengers or passengers with fever in getting into public transport services. We take concern, however, in the provision which mentions the non-commitment of land-based public transport operators to the PUV modernization program. We would like to take note that the PUV modernization programs comes at no better time than this, especially during the time of the pandemic, in order to address the fragmented public transport services that we have in our country, which we have seen to be inefficient, especially in the management and operation of public transport services, as well as especially on the part of government, particularly on the regulatory bodies, not only on the part of LTFRB and the OTR, but also on with other law enforcement agencies that such as HPG, MMDA, where there is difficulty in having to monitor and enforce enforce public health protocol in such a fragmented industry. And one of the aims of this modernization program is precisely to consolidate the operation of these public transport services. We also would like to cite the innovations of programs that has been put in place, not only in land-based public transport, but also all across the transport sectors in the DOTR. I'm referring to the air sector as well as in the maritime and the rail sector. Marami na pong ginagawang programa at proyekto, not only addressing modernization, but precisely, especially during this time of a public health emergency in addressing the prevention of COVID. As you well know, Mr. Chair, transport is something that is not only vital but sensitive in having to address COVID because it addresses mobility of people. And having said that, we also would like to appeal to the Honorable Committee to include a provision and perhaps emphasize the use of integrated intermodal transport terminal, which is also already common in other sectors like air, which uses common airports as well as seaports, but also on land-based public transport. This is also in line and consistent with the National Transport Policy for an integrated and coordinated transport network. Overall, we reiterate our support to these various bills in having to set a better normal for the sustainability and recovery of our economy as a whole. Thank you, Mr. Chair.
Thank you, Chairman Delgra. Balikan lang po natin si DILG Undersecretary RJ Echeverry. Go ahead, Yusek RJ.
I'm sorry, Your Honor. I went to...
No problem.
This level finds no reason to object on the hearing post-legislative measure as they are consistent with sections 15 and 16 of Article 2 of the Constitution, which states, the state shall protect and promote the right to health of the people and instill health consciousness among them. And the state shall protect and advance the right of the people to a balanced and healthful ecology in accord with the rhythm and harmony of nature. In relation thereto, with respect to provisions of the foregoing bills regarding the responsibility of the national and local government, including other stakeholders, to provide testing kits, personal protective equipment, and other medical needs relating to COVID-19, Section 11 of Article 13 of the Constitution provides that the state shall adopt an integrated and comprehensive approach to health development, which shall endeavor to make essential goods, health, and other social services available to all the people at affordable cost. There shall be priority for the needs of the underprivileged, sick, elderly, disabled, women, and children. The state shall endeavor to provide free medical care to paupers. Further, pursuant to Section 16 of the Republic Act Number 7160, otherwise known as the Local Government Code of 1991, local government units shall ensure and promote health and safety, enhance the right of the people to a balanced ecology, encourage and support the development of appropriate and self-reliant scientific and technological capabilities, improve public morals, enhance economic prosperity and social justice, promote full employment among the residents, maintain peace and order, and preserve the comfort and convenience of their inhabitants. Nonetheless, please find herein our observation and our comments. On Senate Bills number 1747 and Senate Bill number 6864, number 1 on Section C, Paragraph 2, of Section 2, may we seek clarification on the duration of the suspension of the operation of motorcycle taxis? How long the suspension shall be imposed? Will Section 16 be applied hereto? Number 2, on Section 6, Paragraph 6, Number 3, it is explicitly provided that wearing a face mask is required while inside a public transportation. Thus, is wearing face shield not mandatory? Also, is wearing a face mask inside a private vehicle not mandatory? Number 3, on Section 6, Paragraph 6, Number 5, 3, who shall have the option on whether quarantine shall be done at home or in an authorized government facility? Also, it is suggested that the parameters regarding this provision be clearly provided in the implementing rules and regulations. On Senate Bill 1792, Number 1, on Section 6, Paragraph C, Number 3, is wearing a face mask inside a private vehicles, again, not mandatory. Number 2, on Section 6, Paragraph C, Number 5, letter C, who shall have the option on whether quarantine shall be done at home or in an authorized government facility. Also, it is suggested that this provision be made applicable to both domestic and international passengers. Finally, it is respectfully recommended that the position of other relevant agencies and stakeholders be solicited. Thank you very much, Mr. Chair.
Salamat, Yusek Echeverry.
Mr. Chair.
Go ahead, Ma'am Amy.
Sorry, now that you can hear me, thank you. Okay, yeah, since we're talking to the DILG, yung aking bill kasi, new normal, hindi lang siya DOH, hindi lang siya public transport, kundi more or less yung pagpaplano ng new normal natin, inclusive dito yung concerns sa ating mga LGU. Ang problema kasi, may version tayo na DILG and LGU will be creating a plan for a new normal. Pagkatapos, alam naman natin, 2022, may implementation of the Mandanas ruling. So itong mga LGUs are deeply concerned that once again, there will be a second health devolution and that the health services will once again be dumped in their laps without a commensurate budget. Lalong-lalo na yung mahihirap na municipality natin na 4th, 5th, and 6th class lamang. Kaya ito yung problema, lalong-lalo na sinasabi ngayon na hindi naman mare-resolve itong issue ng COVID-19 within 2022 kung hindi malamang 2023 pa yan at yung ekonomiya talagang mas masaklap. 3, 4, 5 taon pa ang pine-predict ng ating mga economists. So ang itatanong ko, yung DILG ba at DOH are taking specific planning efforts towards the LGU transition for the full devolution of health services or other Mandanas-related devolution of financial resources as well as the health services?
Thank you very much, Senator Amy. Yes, the answer, ma'am, is yes. We are actually in the DILG planning to issue and prepare the executive order to be signed by the President on...
Nakita nga namin mas lalong ninervyos yung LGU kasi parang pinasa lahat sa LGU pero wala namang budget at saka parang pinagutusan na lamang. Wala naman silang leeway, mas pangit pa kesa dati. Yun ang kinatatakutan kasi alam naman natin kung gaano kahirap ang health devolution na ginanap nung una. Ngayon mauulit na naman. At yung DOH, walang masyadong say doon sa executive order na draft po ninyo. Parang diskumpiyado yung mga LGU doon Kasi pag-uutusan sila ng very specific measures and they have absolutely no say in the matter.
Actually, ma'am, we're in coordination with the League of Provinces and ULAP on the matter. It's still being drafted. Hindi pa ho tapos yung
kasi nga nagka-violent objection, lalong-lalo na sa health services dahil nga COVID tayo ngayon. Tapos once again, ipapasa na naman sa LGU. Wala namang karampatang budget, wala namang skills or technical assistance. Hindi kakayanin ng 4th, 5th, and 6th class municipalities talaga.
Ma'am, we will look in. I don't have the exact answer right now for you, ma'am. But we'll look into it, and let me get back to you on that, ma'am, on the matter at hand. We're
Okay.
still in the process of talking with the governors and the mayors at this point in time on how we could devolve properly the health in lieu of the Mandanas ruling. But if there are
Not
recommendations,
in lieu, in compliance.
yes, in compliance of the
Kasi
Mandanas.
parang pakiramdam ko talagang in lieu because it contravenes the spirit and the purpose of the Mandanas ruling. And instead of giving greater fiscal autonomy to the LGUs, it actually imposes more and more functions on the LGUs from the national government. Parang dinagdagan ng utos, hindi ng kapangyarihan.
The DILG is open to any recommendations from the committee, ma'am.
Well, from my part, as a former LGU chief, for my part, may I manifest to this committee, to the DILG, my objection to the present draft being given to the president, as it in no way complies with the purpose and desire of the Supreme Court decision. At isa pa, kinakailangan mas proactive yung DOH kasi talagang health ang issue dyan. And that's, once again, one of those things that's being dumped on the LGUs without much consultation or even assistance. Yun ang problema dyan.
Ma'am, I think DOH is also in the process of helping us draft the accountabilities and deliverables of the local government. Perhaps the DOH on their part can also share their opinion on the matter.
Galing ni Rico, ha? Okay. DOH na lang daw ang sasagot, Chair.
Go ahead, Senator Amy.
Yes, Chair
Okay na
Bong.
po.
I think yung DOH yata sasagot kasi yung kinatatakutan nga ng mga LGU na madidevolve yung health services samantalang nandito pa rin tayo sa pandemya. Ano daw yung ginagawa ng DOH para magtulungan na lang?
Dr. Beverly Ho of DOH. Are you still around, Ma'am Beverly?
Tanungin na lang ninyo siguro kasi yung bill ko, Mr. Chair, it has to do with overall ng new normal, hindi lang yung DOH, pati yung DOLE, yung paano magre-regenerate nung jobs, yung tinatawag nilang National Employment Regeneration. Sana mabigyan tayo ng plano at maliwanagan kung ano yung liability of employers. Nagkakalituhan kasi kung babayaran ba yung test at vaccine ng employers kung hindi nila kaya. Isa pa yung issue eh.
Isa pa sa dapat nating pag-usapan na Senator Amy, yung preparation po for next year's budget considering the implementation of the Mandanas ruling, di ba? Malaki po ang mawawala sa national government sa budget,
right.
no? So kailangan na nating pag-aralan by now, and I'm sure the executive department is also anticipating that yun po ang mangyayari. Siyempre yung local government units natin, magpe-prepare din po sila ng kanilang budget for next year. Ang national government naman po, magpe-prepare din po ng kanilang budget. So yung budget preparation natin ay talagang babantayan na natin na kung i-fully implement na po yung Mandanas ruling for 2022.
Yes, that's right. Talagang medyo madugo siya kasi syempre may mga national priorities tayo na ayaw naman natin maudlot. Gusto naman natin na tuloy-tuloy yan. At masasabi rin na yung ibang LGU o yung karamihan ng LGU hindi naman na kayang i-implement yung malawakang mga national programs. Pero sa kabila nun, maintindihan rin natin yung mga LGU, may kanya-kanyang priorities kasi iba-iba rin ang sitwasyon ng iba't ibang LGU. At dapat ang tutukan natin yung marginalized LGUs katulad ng 4th, 5th, and 6th class municipalities. Thank you for your understanding po.
Correct, Senator Amy Marcos. May we now hear the answer from Dr. Beverly Ho, if you are still around, from DOH? Wala na yata. If the DOH is no longer around, we will just ask the DOH to submit its response to you, Senator Amy. May we now hear the position of DTI, Remedios Lim, OIC Division Chief, Board of Investments.
Good morning, Mr. Chair, and the DTI support the Senate bill, in particular Senate Bill number 1747, 1792, or an act establishing public health and environmental standards and safeguards for the better normal in workplace, public places, and communities toward a sustainable recovery from the coronavirus disease. The DTI official position paper, Mr. Chair, will be sent once signed and approved by our principals. But just the same, allow me to share with you, Mr. Chair, that the following activities relating to the fight against COVID-19 pandemic are registrable with BOI incentives under the 2020 Investment Priorities Plan. So among those, essential goods, which covers the production or manufacture of medicines, medical equipment and devices, PPE, surgical equipment and supplies, laboratory equipment, and medical supplies, among others, are covered. And also, the repurposing of manufacturing activities to produce the above-mentioned products are also covered for registration. Essential activities are also covered, and this includes the provision of services such as but not limited to health and waste treatment and disposal, laboratories, test facilities, hospitals, and quarantine facilities. So registration of activities must comply with the FDA requirements. So that's it, Mr. Chair.
Salamat po, Ma'am Remedios. May we now hear the position of the CHED, Ms. Sheila Halbuena. Ma'am Sheila.
Yes po, Mr. Chair. Good morning po.
Go ahead po, Ma'am Sheila. May we hear your position?
So, good morning, Mr. Chair. The Commission on Higher Education fully supports the intent of the Senate Bills 1747 and Senate Bill 1642 on the policies for the new normal addressing the effects of the COVID-19 pandemic. So the Commission on Higher Education ensures smooth transition of students to flexible and online learning. As a fact, since the onset of pandemic, several CHED COVID-19 advisories have been issued. CHED Memoranda Orders on Flexible Learning and Learning Continuity Plan were issued, as well as to assist higher education institutions in transitioning to the new normal or better normal of teaching and learning. So the flexible learning strategies, as implemented among higher education institutions, are designed to meet the students' needs, capabilities of faculty members to ensure accessibility and inclusivity without prejudice to the adoption of new measures for online learning. Also, Mr. Chair, considering the landscape of education in the Philippines, it is also suggested that the Commission on Higher Education be one of the members of the new normal development task force. That would be all, Mr. Chair. Thank you.
Salamat, Ma'am. From may we now hear the Ma'am Sheila Albuena. May we now hear the position of TESDA, Celestino Millar, kindly.
Thank you very much, Mr. Chair. Good morning, Mr. Chair, and to all the members of this committee and to all the other resource persons. Basically, Mr. Chair, I will provide the committee with the summary or the highlights of the test the position paper that will be submitted to formally to the committee once it is signed by our secretary. Basically, Mr. Chair, TESDA would like to submit its concurrence and approval of the general objectives of the bills that intends to establish public health and environmental standards and safeguards for the better normal in the workplace, public places, and communities. Basically, Mr. Chair, as with other institutions and organizations, when the COVID-19 pandemic struck and the president declares lockdowns and put the country into enhanced community quarantine, suspension of classes and technical vocational institutions was implemented. And pursuant to IITF issuances, Mr. Chair, TESDA issued several TESDA circulars in response to the pandemic. Basically, some of these, Mr. Chair, includes the directing TESDA technology institutions engaged in dressmaking to produce face masks that were distributed to frontliners and even to test the skeletal workforce. TESDA also issued TESDA circular on the adoption of flexible learning modalities to carry on with debate programs pursuant to the issuances of IATF and with the permission, of course, of the respective LGUs. Consequently, also, Mr. Chair, TESDA scholarship programs now includes budget or allocation for protective goggles, face masks, and even allowances for internet to be availed of by TESDA trainees, Mr. Chair. Of course, TESDA welcomes the inclusion of the agency as and the provision of educational support and assistance to students, especially in adapting to online learning and other programs. And TESDA also welcomes its inclusion as a member of the New Normal Development Task Force, as we believe that debate programs can help tide over the country the effects of the pandemic, Mr. Chair. TESDA also developed the contact tracing training programs so that persons can be given competencies on how to do contact tracing activities, and that was developed in coordination with the OH, and those graduates of contact tracing can be used by DIFG in the conduct of contact tracing activities in the communities. And of course, through the online programs, COVID-19 related programs were included as part of the programs in the online programs that would include modules on COVID general duties, COVID awareness, managing debate during COVID-19, learning online during COVID-19, teaching online during COVID-19, and standard precautions such as hand hygiene, and the other one is COVID-19, how to put on and remove personal protective equipment. The detailed position paper, Mr. Chair, of TESDA will be submitted to your committee once it is signed by our secretary. Thank you very much, Mr. Chair.
Salamat po, Sir Celestino. May we now hear from DICT Attorney Elias Omar Sana, Chief Legislative Liaison Division of DICT.
Mayang buntag, Mr. Chair. Good morning, honorable senators. We will be submitting our official position paper with specific comments, but for today, preliminary comments po, we'd like to express our full support for the Better Normal and New Normal bills. We thank the committee, especially for allowing us to give our comments today, and we laud the bills because of the recognition for the need for access to fast and affordable internet connection and digitalization of government public administration and functions. The ICT-enabled systems and solutions being discussed in the bills are actually complementary to those programs and projects that we already have with the department. Currently, for example, our free Wi-Fi for all, we have installed over 8,000 live sites in the Philippines. We also note that the bills push for the National Broadband Program, the Central Business Portal, for our PNPKI infrastructure for digital signatures. Part of our programs and projects as well for flexible learning is we've been exploring the use of digital broadcast for learning and the use of a learning management system for higher education. All these programs and projects we will discuss further in our position paper. But for today, we would just like to express our commitment po to helping the country shift towards a better normal. That's all, Mr. Chair. Thank you.
Salamat po, Sir Attorney Elias. May we now hear from Dole, Sylvia Valdez, OIC Division Chief, Program Management, Technical Support Services, Bureau of Working Conditions. Go ahead, Ma'am Sylvia.
With the permission of Ms. Sylvia Valdez, to read the department's position on the proposed Senate bills 92 and 1642. Okay. The DOLE recognizes the significance of the proposed bills as it will properly and immediately provide guidance and assurance to workers' safety and health while in transition to the new normal. With approval of the bills, it will institutionalize the existing protocols and standards and other preventive measures and will ensure continuous implementation and enforcement of minimum safety and health standards and protocols in workplaces being monitored by DOLE. The DOLE supports these bills filed by Senator Francis Tolentino and Senator Amy Marcos to sustain the efforts of the government, especially DOLE, in ensuring workplace safety and health against COVID-19 and providing support to existing and emerging businesses to preserve and create employment. Recognizing that both workers and establishments are in a vulnerable situation and greatly affected by the pandemic, the bills will be able to immediately respond to the need of stimulating the economy while ensuring protection of the workers. For our comments on Senate Bill 1792, we support the inclusion of the provision covering workplaces under Section 6E Better Normal for private, commercial, and industrial workplaces. Number one, the requirement of a better normal workforce and workplace management plan, or simply called management plan for all businesses, for all business establishment with a standard template to be prepared by DOLE as proposed in the bill is an important tool for the establishment to mitigate the spread of COVID-19 as establishments resume operation. However, the role of the LGUs in monitoring compliance and implementation of management plan and periodic conduct of inspection of private establishments within their jurisdiction and the conduct of safety and health inspection audit by the DOLE should be clarified or harmonized to avoid overlapping of functions and create confusions among establishments relative to their compliance with minimum health protocols, considering that DOLE has an existing monitoring checklist being used to checking compliance relative to the guidelines on the prevention and control of COVID-19 in the workplace pursuant to DTI-DOLE JMC. Number two, on the provision to workers under the work from home scheme to be given a minimum of 1,000 pesos monthly allowance to compensate utility consumption needs further review, as it is recommended in consideration with the capacity of employers, especially the MSEs, to provide such. Moreover, provisions on the testing requirements and shuttle services be harmonized also to the issued DOL-DTI JMCs and clarificatory advisories 20-01, 20-02, and 20-03. Sections that will give details on vaccination program and monitoring are likewise recommended. For our comments on Senate Bill number 1642, please find the following. Number one, Section 3, Healthcare Delivery System. Under this section, it is recommended to have provision on the procurement of vaccine and must have massive promotional campaign all across sectors in providing awareness on the importance and benefits of being vaccinated. On Section 5, job provision and protection to include provisions that will ensure security of tenure to the most at-risk populations or DMARPs. Number 3, Section 7, New Normal Development Task Force. It is recommended to include the Department of Trade and Industry and Department of Information and Communication Technology in the composition of task force member agencies. Number 4, Section 8, Resilience and Response Programs. Recommendations on to provide community support group not only for the repatriated OFWs but to the vulnerable sector as a whole. And on the digitalization of the government system, the bill must ensure the stability and security of internet connection. Number 5, Section 9 for promotion, engagement, and management of public spaces. Conduct of social activities may be allowed provided strict adherence to all health protocols must be observed, not only social distancing. It may also worth considering in the bill to identify a designated personnel from the LGU to monitor social activities, gatherings as may be allowed by the IATF. And lastly, Section 10 monitoring. Provide a provision on encouraging industry associations to practice self-regulation among its members on the workplace compliance with the health protocols prescribed by the IATF and the Department of Health. Further, if approved, these laws will further strengthen DOLE's conduct of safety and health audits of all workplaces as exposed in the bill. For your consideration, Mr. Chair. That's all pa.
Maraming salamat po, Sir Mark. May we now hear from the Civil Service Commission, Assistant Commissioner Rodolfo Encajonado. Go ahead, sir.
A pleasant day to everyone, especially special greetings to the revered senators who are present today, particularly Chairman Bongo, Senator Mig Suberi, and Senator Amy Marcos. At the outset, the Commission, under the leadership of Chairman Alicia de la Rosa Bala and Commissioner Eileen Lourdes Sada, fully supports the passage of the better known bills filed in this August body by Senators Tolentino, Angara, and Marcos. The bills, once consolidated with some comments and suggestions from the resource agencies, would intend not only to prepare and educate the Filipino people for a new way of life and provide them with mechanisms that have long-term effects on their lives, but also provide work-safe places, ensure protection of health, safety, and welfare of the state workers, as well as private workers, and also ensure, in order not to prejudice public service delivery. By the way, the Commission will be submitting its comments after this meeting, and we have prepared a draft comments on this, and please allow me to read the same. only the list because medyo mahaba na. So upon review of the Senate bills and better normal, the Civil Service Commission suggests to adopt the versions of Senators Angara and Tolentino, particularly on the coverage on the guidelines for health and safety protocols, as well as guidelines in better normal in the educational institutions, workplaces, public spaces, and others. The two bills are similar to that of House Bill number 6864 passed in the House of Representatives. And I would like to state some of our comments. Well, the CSC agrees with some of the provisions enumerated as Section A on universal and mandatory health and safety measures, as some of the measures are similarly provided under items number 4 and items number 5 3 of Civil Service Commission Memorandum Circular number 18 series of 2020 pertaining to the amendment to the revised interim guidelines for alternative work arrangement and support mechanisms for workers in the government during the period of state of public health emergency due to COVID-19 pandemic. Specifically, Section 4 of the said Memorandum Circular on support mechanism provides as follows. Health, psychosocial interventions like stress debriefing, provision of appropriate personal protective equipment to frontline service providers and employees, reduced working hours as authorized by the President, reasonable transportation facilities and housing quarters should be provided to employees assigned a skeleton workforce whenever practicable and subject to the budgeting, accounting, and auditing rules and regulations. Reasonable expenses incurred during the work from home may be defrayed by the agency, subject to budgeting, accounting, auditing rules and regulations, and other monetary forms of incentives as may be allowed by the Office of the President or other authorized agencies or upon approval of the head of agencies, subject to budgeting, accounting, and auditing rules and regulations. With regard to Section 5.3, it reads, disinfection of the decommissionation activities on all its buildings, facilities, and vehicles. Disinfection should be part of the regular maintenance and upkeep of the agency. Then we have the conduct of health status survey to ensure that all those reporting to office are in tip-top shape and that no one is exhibiting any of the symptoms of COVID-19 diseases. And modification of workplace, if practicable, to ensure observance of physical distancing requirements. And for other alternative work arrangements that require physical presence in the office, physical distancing requirements should always be observed. In addition, agencies are required to implement minimum health standards protocol at all times, such as wearing of the face mask, face shield, taking of body temperature, and presence of sanitation station and other appropriate PPE. And of course, we also suggest that agencies may use video conferencing, teleconferencing in conducting meetings to minimize face-to-face interaction. Likewise, the Commission provides under Section 5.7 of said guidelines, wherein it directed government agencies to adopt monitoring mechanism during the implementation of the alternative work arrangement they adopted and implemented in their respective agency, as well as requiring them to formulate their internal rules and regulations in adopting the guidelines, and they are required to submit a report on its implementation to the Civil Service Commission for policy formulation. And then under Section 6A of the proposed bill, we recommend that continuous implementation of alternative work arrangement in the public and private sectors be included in the bills to lessen physical interaction among employees in the workplace. and a provision of alternative work arrangement should be added as follows. Under item 16 or 17, continuous implementation of alternative work arrangements in the public and private sector. We commend the provision in section 6, particularly A6, which directs all agencies to have communication plan for the better normal, which will articulate to their employees the policies and interventions to be adopted by the agencies. In the same section, which provides for the placement of relevant on-site signages and online information materials, we recommend that these signages and information materials include instructions and infographics on proper cough and sneezing etiquette. In section 6B, better normal for school and education institutions, the CSC loads the provision which states that in public and private institutions, including private colleges and universities and other accredited learning and or training institutions, shall prioritize the establishment of online platforms for continuing professional development or CPD and mandatory legal education or MCLE. In order to include constitutional bodies, among others, Civil Service Commission, with the corresponding mandate in the matter of e-governance, we suggest that Section 6, G1, to include a phrase which states as follows. 1. Establishment of various forms of electronic digital governance, which includes e-governance, mechanism in coordination with the appropriate government agencies and the private sector. It may be worthy to note that there is a provision in the bills addressing the mental health concern of employees, both in public and private sectors. With COVID-19 dominating the lives of government employees, realities such as economic losses, additional responsibilities at home, and increasingly heart-rending headlines, all taking toll on the mental health of government employees. As much as the world adopts social distancing to do their part to flatten the COVID-19 curve, many are experiencing increased feelings of stress, anxiety, sadness, or loneliness. While the bills provide for measures to address the physical health of employees, we suggest that a provision be added in relation to mental health. Provisions relating to promotion of mental health wellness activities, such as stress management and conduct of mental awareness or education activities, will be particularly helpful to employees. Moreover, employees with mental health issues at work may be provided with appropriate interventions, treatment, program, and referral systems. And in relation to this, CSEMC number 4, series of 2020, provides for the guidelines on mental health programs in the public sector. And before I close our comment, I would like to inform the honorable senators that the commission is now preparing for another guidelines on flexible work arrangement in the government that would be applicable during the transition period for national public health calamity or emergency to better normal, as well as provide measures that would address the emergence of any infectious diseases and natural and man-made calamities to ensure its continued operation and ensure the health, safety, and welfare of state workers without prejudice to the delivery of public services. So with that, that's all. And then rest assured that the Civil Service Commission will submit its written comment to the committee within the week. Thank you.
Thank you, Sir Rodolfo. May we now hear from the Attorney Abraham Giao, OIC Director, Administrative Services.
Thank you very much, Mr. Chair. Good morning, Mr. Chair, Senator Christopher Bongo. Good morning, Senator Amy Marcos and Senator Migs Subiri. On the part of the Department of Agriculture, Mr. Chair, we interpose no objection to the better normal bills, namely Senate Bills number 1792, Senate Bill number 1747, Senate Bill 1642, as well as House Bill number 6864. We will submit, Mr. Chair, our written position paper once it will be signed by our Secretary, Mr. Chair. And on our part, Mr. Chair, on the Department of Agriculture, may we substantially provide you the contents of our position paper on these better normal bills, rather. Mr. Chair, as to Senate Bill number 1747, we recommend, Mr. Chair, particularly in Section 6, in page 9, line 12, number 2 or item 2, that strict adherence to land use planning and zoning must be in accordance to RA 8435 or the Agricultural and Fisheries Modernization Act and other issuances under the Office of the President pertaining to reclassification as well as to conversion. As to Section 6 also, Mr. Chair, of the same Senate Bill number 1747, page 9, line 14, item number 3B, which is entitled Management Spaces. Mr. Chair, may we recommend that the LGU, in coordination with the Department of Agriculture, shall enroll all their available spaces for us to have an urban gardening program with all, particularly in the Metro Manila areas, Mr. Chair. Same with Senate Bill number 1747, under page 20, line 30, item KH. We suggest that the ALG and the Department of Agriculture will work things pertaining to the issuance of food passes for us to have or for us to ensure swift food access for our agricultural products. As to page 17, line 6, item H, with the same bill, Mr. Chair, may we respectfully recommend, Mr. Chair, that there will be a rationalization of manpower as to national government agencies to include a health and safety officer, at least one doctor and one nurse with all government agencies for us to assist in how to cope with this better normal as well as to instruct us on how to comply with the minimum health standards. And with the same Senate Bill, Mr. Chair, number 1747, may we respectfully recommend also that a capital outlay be given also to the national government agencies for them to procure and implement the minimum engineering design for us to have this implementation of the physical distancing, as well as, if possible, the establishment of health facilities and dormitories for employees, particularly those residing outside Metro Manila. And lastly, under line 23, page 17, item 4H, section 7 of Senate Bill 1747, we recommend those government employees working on site will be provided with shuttle services also, Mr. Chair, and additional, if possible, additional medical leave or privilege leave for them if ever they will be considered as probable, suspected, or confirmed with COVID-19 case. Mr. Chair, as we read through the contents of House Bill 6864, it has the same contents with that of Senate Bill 1747. So we reiterate our recommendation as to the Senate Bill 1747 with House Bill 6864. Mr. Chair, as to Senate Bill 1642, as to Section 5, line 23, page 2, The NGAs may include the programs of hiring skilled, semi-skilled workers and unskilled to government offices, sites, and or satellite offices, Mr. Chair. And lastly, Mr. Chair, under Section 6 of Senate Bill 1642, also, Mr. Chair, may we recommend also that the Department of Agriculture be authorized to directly procure agricultural products from the farm gate or from the farmers, especially those small farmers that cannot issue receipts, Mr. Chair, that the Department of Agriculture as to procurement of agricultural products be exempt from RA 9184 or the Government Procurement Reform Act, Mr. Chair. As to our formal written position paper, Mr. Chair, rest assured we will submit to you once it will be approved by our Secretary, Mr. Chair. That will be all, Mr. Chair, for the Department of Agriculture. Thank you.
Mr. Chair?
Maraming salamat. Go ahead, Ma'am Amy.
Yes, thank you very much on the comments of DA regarding 1642, my bill. And yes, we're in full support of giving the DA finally the power to procure directly from the farmers who need every support or subsidy that they can get. To date, the excuse has always been that only the NFA is allowed to buy rice and corn, whereas the rest of the department is unable to do so. Sa ngayon, talagang yan ang kailangan na tulong na bumili direktamente sa ating mga magsasaka. Imbes na samantalahin pa sila ng iba't ibang trader, aggregator, cartel at biyahero. Maraming salamat sa suporta ninyo.
Thank you very much, Senator. Thank you, Mr. Chair.
Salamat po. May we now hear the position of League of Provinces, Ms. Angelica Sanchez. Go ahead, Ma'am Angelica.
Yes, good morning, Mr. Chair, Senator Bongo, Senator Mig Subiri, and Senator Amy Marcos. So the League of Provinces of the Philippines fully support the spirit and intent of the bills, with local government units as inherent partners in the revival of the economy. Inasmuch as we are crafting legislation towards a better normal and taking on from the lessons and experiences from the pandemic governance, the League would like to emphasize the necessity for a stronger partnership and consultation between the national government and LGUs, particularly in setting policy directions so as to ensure seamless transition from policy to its implementation. Hold on. As the Local Government Code has always emphasized, it is imperative that local governments are always consulted on policies and programs to be implemented by the national government. We recognize the need for the national government to set standards and general framework policies, but it is also necessary that LGUs are properly consulted and even made part of the discussions at best, prior to releasing this for the implementation by the latter, inasmuch as the situations obtaining at the local level are as different and as diverse as there are LGUs in the country. In order for us to seamlessly transition to a better normal, it is necessary to ensure the implementation of policies and that the implementation of policies and standards should be given emphasis. Good intentions must be translated into well-monitored actions on the ground and among the citizenry themselves. We shall be submitting our comprehensive position papers on these bills, Mr. Chair. Thank you very much.
Salamat po, Ma'am Angelica Sanchez. May we now hear from League of Cities, Ms. Janelle Rabe.
Thank you, Mr. Chair. On behalf of the League of Cities of the Philippines, I would like to express that we will have our official position paper ratified and approved by our National Executive Board. But in the meantime, I would like to share that the League commends the laudable intent of the bills by Senator Amy Marcos, Senator Sonny Angara, and Senator Francis Tolentino. We will submit our comprehensive position paper, but in the meantime, we would like to comment that in SPN 1747, we support the provision that recognizes the authority of LGUs to order the temporary closure of private buildings or establishments with known COVID-19 infections. We would also like to recommend that the League of Cities of the Philippines is included in the crafting of the implementing rules and regulations, so that, as mentioned by our colleague from the League of Partners of Provinces in the Philippines, we are recognized as partners, and we have a significant role in crafting the implementation of these bills. So the League commends these bills for clearly stating the expected tasks and responsibilities of local governments, as clearly explained in various sections. We also commend the manifestation of Senator Marcos for taking note of the impact of the Mandanas ruling, which will have a significant effect in the implementation of bills. We will submit our ratified and approved position paper as soon as possible time. Thank you, Mr. Chair.
Salamat po, Ma'am Janelle. May we now hear from the Employers Confederation of the Philippines, Robert Maronilla. Go ahead, Sir Robert.
Mr. Chairman, good afternoon. Good afternoon, other members of the committee. I'm just going to go direct to the point, Mr. Chairman. So with Senate Bill 1642, we don't have any comments as much as we support the said bill. Regarding Senate Bill 1792 and Senate Bill 1747, meron lang po akong few concerns that would affect employers, particularly the micro, small, medium enterprises. In Section 6, on having a management plan, we suggest that the bill would provide a template to guide the MSMEs. Alam naman natin the MSMEs would find it difficult to comply normally. Next is the under Section 6, letter F4. It says here that all private commercial businesses shall shoulder all expenditures in complying with the mandates of this act. I would just like to clarify, because in the bill also it states that, let's say, testing would be provided by the PhilHealth. So sana lang po clear po dito that we all know that that employers already pay for other costs like face masks, face shields. We accept that, signages, thermometers, etc. But pagdating po sa testing, we believe that this is the role of the PhilHealth and not the employers po. So for now, yun lang po ang main concerns namin, and I'm manifesting that I will be submitting a position paper on the as a whole very soon, Mr. Chairman. Thank you.
Salamat po, Sir Robert. May we now hear the position of Dr. Carlo Panelo. Back to you again, Dr. Panelo.
Good morning again, Mr. Chair, Senators Marcos and Subiri. Thank you again for inviting me to provide my inputs to the different better normal bills. I wish to commend both houses of Congress for taking this much initiative to pass this much needed legislation. This provides us the opportunity to codify the measures that were proven effective in dealing with the pandemic, address gaps in policies and regulations, and program investments to ensure resiliency of our systems. I noted that Senate Bill numbers 1747 and 1792 are largely similar with House Bill 6864. Senate Bill 1642, on the other hand, describe in broad terms the needed measures and complements the other bills. A compromise on the level of specificity between SB 1642 and the other bills is recommended for the committee report to come up with a version that provides sufficient direction without constraining the ability of the executive branch to later innovate and adapt to evolving situations, especially in dealing with emerging and re-emerging infectious diseases and other forms of public health emergencies. It is my understanding that the laws provide the framework of things to be done, and that specific implementation strategies and interventions are best left to the executive branch to specify. Collectively, the bills describe a pandemic resilience strategy for both the short to medium term. A more generic titling is recommended to emphasize that the measures to be put in place go beyond addressing the COVID-19 pandemic, but also to prepare the country to respond to future public health emergencies, even those that we do not know yet the name, the nature, and the effects of such emergencies. Alternatively, these bills can be consolidated into a measure to ensure resiliency against public health emergencies. In particular, I would advise against codifying the following in the law. First, legislating the use of specific technologies such as RT-PCR testing or the adoption of pooled testing, not because these are ineffective, but that this could be rendered obsolete over time as technology improves. National government provision of free masks to the general population can be logistically untenable and financially unsustainable over the long term. It may be that at the immediate phase of an epidemic threat, a stockpile would be necessary to contain an outbreak in specific areas or populations. But over the long term and at national scale, subsidies for these kinds of inputs are best targeted for the poor. For the rest of the population, access to PPEs like masks can be provided through employers, through schools, through LGUs, and via retail outlets to be purchased by individuals. Also, the specification of suspension of certain services like transportation or the imposition of specific measures like mask wearing are powers that are best delegated to the executive branch, as its imposition, modification, and lifting of use is highly dependent on evolving situations and evidence. The law might constrain the actions of the executive when these are codified in law. It is also very commendable that the bills are providing for adaptation measures from a whole of government or whole of society perspective. And the law would be best used to codify and enforce policy and regulatory measures to promote resiliency for future public health emergencies. Among these include the development of a public health emergency strategy and plan at national, local, and institutional levels to be integrated in disaster plans that are in place. This includes the mechanism for national government to ensure some uniformity in response similar to what the current IATF is trying to do. There is also need to develop building standards to adapt to requirements of controlled ventilation and access and isolation. And this would require investments in retrofitting existing facilities. Communications policies and regulations are needed to allow contact tracing, such as through the use of the telco facilities, similar to South Korea and Taiwan, that allowed them to quickly contact trace possible infected individuals. Data regulations allowing sharing of data and interoperability of various government and private databases may also be necessary. Social security policies also need to be put in place to ensure release of social amelioration support when triggered by declaration of an emergency. These kinds of social amelioration programs can be codified and immediately triggered upon the declaration of an emergency as provided for by law. Monetary regulations may also be needed to hasten the shift to digital financial transactions to facilitate release of social support and minimize risk of exposure. We also recommend the mobilization of healthcare institutions and healthcare reserve force and complementary guidelines for practice that will allow deputization, substitution, and interoperability in times of emergencies. The creation or a designation of a scientific body to arbitrate conflicting evidence might be also of great use in future pandemics, and as well as a review of public health delivery systems and the creation of a Philippine CDC, which I understand Congress is already working on. And more recently, with our experience with vaccination, reforms in procurement regulations may be needed to allow us to do advanced purchases and even allow government to invest on very new or nascent technology similar to Operation Warp Speed in the US. In terms of investments, these are the things that I would say would need to be considered. Number one is the retrofitting of our hospitals, quarantine and evacuation and shelter facilities to allow for their easy conversion to deal with pandemics as well as other public health emergencies. Investments in ensuring a telemedicine and EMR facility for the public sector. The creation of epidemiology and surveillance positions at the primary care level, and the establishment of diagnostic laboratories, again linked to the creation of a Philippine CDC, a legislation of which is currently pending in Congress, and the legislation of an emergency fund release mechanism for individuals. Daghang salamat. Good morning po ulit.
Salamat po, Sir Dr. Panelo. May we now hear from Dr. Vicente Belisario from the UP Manila College of Public Health, if you are still around.
Yes po, sir. Mr. Chair, can you hear me, Mr. Chair?
Go ahead,
Dr.
Doctor. Salamat.
Thank you very much. Mr. Chair, Honorable Senators, the University of the Philippines, Manila, to include the College of Public Health, the Simeon Tropmed Regional Center for Public Health, support the legislative initiatives on the new and better normal, namely Senate Bill 1642 of Senator Marcos, 1747 of Senator Angara, and 1792 of Senator Tolentino. We will forward our full written comments on the said bills at a later time, Your Honors. But just a short statement today that will convey the sentiments of the higher education sector in the health sciences that includes public health. While it is important to establish public health and environmental health standards and safeguards for the new or better normal in workplaces, public places, and communities towards sustainable recovery from the COVID-19 pandemic, it is also important to consider other important specific settings, like schools and universities, to emphasize the inclusiveness of the bills that will affect the whole of nation approach. In public health, we call this the healthy settings approach, Your Honors, where leadership of the health and each concerned sector, as well as intersectoral collaboration, are demonstrated to help ensure a more inclusive approach in ensuring the public's health, that of preventing disease and promoting health. This is the discipline of public health. One of the major gaps exposed by the COVID-19 pandemic was the lack of adequate capacity to initially respond to what was then just an outbreak, Your Honors, that became an epidemic and finally a full-blown pandemic in a timely manner. One of the areas that could be attended to more intensively in the near future is to enhance the capacity to collect, process, and analyze health-related data that will provide solid basis for formulation of policy, timely response and action by the health and other concerned sectors at national and local levels. Higher education institutions in public health and other health sciences may be capacitated and directed to help the Department of Health, the Department of Interior and Local Government, and other concerned line agencies of national government in this major task of capacity building of local government as well as local health units. While capacity to train health and allied health professionals exists in the country, training in public health along with its subdisciplines like epidemiology, biostatistics, health policy, health promotion, and education, among others, as a specific field of expertise is largely still Manila or National Capital Region centric. Thus, a need to help enhance this capacity to train others in strategic, if not post regions in the country. Senator Amy Marcos might be interested to note that before the pandemic, we were preparing to help Mariano Marcos State University up north to enhance public health capacities there, Your Honor. Of course, this was disrupted by the pandemic. We hope that the Senate and House bills will consider inclusion of enhancement of higher education in public health and its subdisciplines, and provision of the necessary support as part of their provisions so that we will be able to better address the lingering COVID-19 pandemic, future outbreaks, which we hope to be able to nip in the bud, that will not become epidemics and another full-blown epidemic. Along with, and mind you, we have other unfinished business, the remaining public health challenges where the Philippines can do much, much, much better, especially those prioritized by the United Nations Sustainable Goals. We do have unfinished business, Your Honors, in tuberculosis. The Philippines is one of the top-notchers nation worldwide. HIV continuing to rise in most countries. It's in a decline. The lingering infectious diseases of poverty that make people remain in poverty, the emerging and rising non-communicable diseases. These diseases that I have talked about kill much, much, much more than COVID-19, but we hardly talk about these things. We have mental health, as posed by the previous speaker, all in a whole of government or whole of society approach. The bottom line, the need to enhance capacity in public health and public health-related disciplines in strategic regions, if not in most regions in the country. I end there, Mr. Chair, and we hope and look forward to sending to you our detailed comments at a later time. Thank you, sir.
Maraming salamat po, Sir, Doctor. May we now hear from Philippine Mental Association, Dr. Philippine Medical Association Secretary, Committee on Legislation, my relative, Dr. Maria Roda Goco. Pareho tayong go, ma'am. Go ahead po.
Opo. Good afternoon, Mr. Chair, Senator Go, Senator Marcos, and Senator Zubiri. We honor your noble intent in both bills. If I may be allowed to speak for both, in behalf of Dr. Benito P. Atienza and the 45,000 formal contributors, the physicians that are formal contributors to PhilHealth. This bill is really a welcome respite for us all. Despite the fact that this increase was deferred for this year, most of our contributors can no longer afford to pay the 1-year or 3-year premium payments. We all pay in installments, but we pay, sir. Knowing the universal healthcare law, we also recommend that we revisit the financing policies of PhilHealth as we try to encourage our physicians to continue being accredited and being stakeholders of PhilHealth. Furthermore, as we discuss the second bill, we also support the new normal wherein the public health and environmental standards will be evolving, an evolving national issue, but we are also offering our expertise on this health arm, and we will be giving specific recommendations for each item. Thank you and good afternoon.
Maraming salamat po, my auntie. Sinong next? Salamat po. If there are no more questions, we can wrap up this meeting. I thank our resource persons for their inputs and comments. All the concerns and positions raised are well taken and will be considered in the drafting of the committee report. Thank you. This hearing is hereby adjourned. Salamat po sa inyong lahat.
Thank you, Mr.
Magandang
Chair.
hapon.
Thank you to all the resource people. Thank you.
Thank you, sir. Thank you.
Thank you, Mr. Chair.
Thank you,
Daghang
Mr.
salamat,
Chair.
Chair. Thank you.